Hi, everyone. My name is Colleen, and welcome back to another live stream brought to you by Princess Dental Staffing. Happy to see everyone on this Wednesday. So today's topic, we're talking about how to become how to go from being a dental assistant to a dental hygienist. So last week we talked about how to transition from being a dental hygienist to a dentist, and this week we're talking about dental assistant to dental hygienist. Okay, and this week we're going to be talking about a lot of the same things. Just with focusing on obviously dental assisting and dental being a dental hygienist. Okay, and we're going to be talking about the differences between the two, the similarities, and how you can start your journey towards becoming a dental hygienist. Okay. But of course, before we get into that, just want to remind everyone that each week Princess Dental Staffing is bringing you a new live stream, and we're covering topics that talk about your career in the dental industry. So if you don't want to miss out on future streams, be sure to follow our page or subscribe to our channel. If you have any thoughts or comments or anything that you want to contribute to the conversation, be sure to comment below. And if we couldn't get to your comment when this stream was live, then we will absolutely do our best to get to it and respond as soon as possible. Okay. And if you have some time today, be sure to hop onto princessdentalstaffing.com. So, Princess Dental Staffing is an online dental job board, and they have positions available for dental receptionists, dental assistants, dental hygienists, and yes, dentists in a variety of different areas. So, you can hop onto their job board today and see what positions are available in your area. They offer full time, part time, temporary, and permanent roles. You can also create a profile and get your information in front of hiring managers and decision makers. And you can also check out their blog, which covers a lot of the same topics that we cover in these live streams. So you can read about them as well. Okay. Alrighty, so let's jump into today's topic. We are talking about transitioning from a dental assistant to a dental hygienist role. So let's start off by talking about what a dental assistant is, okay? So, dentists and dental hygienists collaborate with dental assistants to treat patients more quickly and more in a more streamlined fashion, okay? So dental assistants are usually responsible for things like getting ready for cleanings, tests, and procedures, assisting dentists with operations, providing them with instruments and keeping an eye on the patient, and arranging appointments and dating patient records, among other office management and administrative tasks as necessary. Okay, so that's kind of where dental assistants kind of fit into the organization in the office. Okay, now by contrast, let's talk about what a dental hygienist does. Okay, so, dental hygienist serves the patients without the guidance of a dentist and is accountable for the following, okay? Utilizing specialized tools to eliminate plaque accumulation while cleaning patients' teeth, examining patients for oral and gum problems, discussing the best course of action for specific conditions with the dentist, teaching people how to care for their teeth by brushing and flossing properly, really important, using local anesthetics to reduce pain and sensitivity when performing cleanings, obtaining and evaluating x-rays, and arranging for follow-up cleanings for the patient. Okay, so definitely we can already see some similarity just in examining what a dental assistant does and what a dental hygienist does. We can already see some similarities and some differences in their roles within the office, but both roles are definitely vital. They're both necessary in order to achieve exceptional patient care and service. Okay. Alrighty, so let's talk about let's go a little bit more into detail on some of the differences between a dental hygienist and a dental assistant, okay? So let's start off by talking about education, okay? So some states require that dental assistants undergo a professional certification or diploma program, and that can take anywhere from 9 months to a year generally. And again, and this is something that we kind of talked about last week, the requirements are going to be different from state to state and maybe even region to region. Okay. So we're going to talk really in a lot of generalities. Okay. When it comes to things like education and certification, because it just kind of differs on the state and the region that you're in. Okay. But generally, dental assistants have to complete a professional certification or diploma program about 9 to 12 months to complete. You can also, as a dental assistant, you can also obtain an associate's degree in dental assisting. That's a choice that you can make, again, depending on the state. But both programs offer coursework in things like human biology, dental science, and dental procedures, as well as practical training. Okay. So, normally at the end of the program, students have to participate in a practicum. Okay. Under the guidance, usually of another dental assistant, a dental hygienist, and/or a dentist. Okay. Now, by contrast, a dental hygienist has to complete an accredited dental hygiene program, usually at a community or a technical college or maybe a vocational school, university, something like that. Okay. The most common of these programs is usually a 2-year program. Okay. But some dental hygienists do choose to go on to get a 4-year bachelor's degree or a master's degree, 2-year master's degree, or an expedited certificate program as well. And again, what is available to dental hygienists is going to be really dependent on the state or the region. Generally, though, dental hygienists, you're just required to get a 2-year degree. Okay. But you can get a 4-year bachelor's or a graduate degree as well. Okay. And in those programs, students take biology, chemistry, dental science courses, and they have to learn how to perform things like dental cleanings, exams, x rays, and other job related duties in the classroom in order to get practical experience. They also have to complete clinicals. Okay. Basically, just a practical application of everything that they learned, right? Carrying out cleanings, other responsibilities, and they're usually observed under a hygienist, another dental hygienist, or a dentist. Okay. All right. So, excuse me. So those are kind of the differences between the education. All right. So let's talk a little bit about, let's go a little bit more in depth on the training that's required. So both hygienists and assistants have to receive hands-on training when finishing their program, their degree or certificate program, like we just talked about, practicum and practicals and clinicals, right? And they also receive extra training in their general responsibilities. For example, a dental assistant in their first role might be trained on office software, preferences of the dentist and the hygienist, particular requirements of the patients they work with, and things of that nature. Whereas dental hygienists might receive training on cutting edge tools, intricate cleaning techniques for dental cases, and also receive software training. And those sorts of things, okay? And something else that's worth mentioning here, if you are a dental assistant and you decide that you want to work towards becoming a dental hygienist, that work that you completed as a dental assistant is really great training, right? Not part of the program necessarily, but it's great training for the future because you learn a lot of key information and skills in being a dental assistant that can definitely be applied to being a dental hygienist. Okay. And we'll talk about those a little bit more in detail a little bit later. But that's also considered, some really great training to prepare you to become a really great dental hygienist. Okay. Now let's talk about certifications and licensure. Okay. So dental assistants can become certified dental assistants if you want to. Certified dental assistant test is for dental assistants who want to pursue national certification. So that's really helpful if you're a dental assistant and you want to practice in multiple states, or you're planning on moving at some point, or something to that effect. Okay. But if you decide that you want to become a dental assistant, before taking the exam, you have to have completed a recognized certificate program, right? Certification program, or have at least 2 years of working experience as a qualified dental assistant. Okay. So being a CDA is optional. You can also be a registered dental assistant, which some states will require that, some states will not. Again, it just really depends on the state and the location that you're in. Okay. So on the other hand, though, dental hygienists have to obtain a license in the state that they're in, or excuse me, the state that they wish to work in. Okay. They're required to complete that accredited education program, pass clinical exams, and pass the state proctored exam in addition to the National Board Dental Hygiene Examination, the NBDHE. Okay. So after acquiring a license, so basically, dental hygienist has to complete the program, the accredited program. They have to pass clinicals. Then they have to take the state licensure exam, and they also have to complete the NBDHE. Okay, so it's a lot, a lot of steps. Okay. And then after acquiring a license, they must also take continuing education courses in order to renew their qualification, which I believe is annually, if I'm not mistaken. But continuing education and professional development courses, all right, in order to keep and renew that license. Okay. So definitely a lot more in terms of certifications and licensures that you have to have in order to be a dental assistant. Okay. Now let's talk salary. Okay. Let's talk salary. So dental hygienists on average make $78,566 annually, whereas dental assistants earn annually on average $59,790. Okay. So not quite a 20,000 a year difference. Okay. And now, of course, when it comes to things like earning potential for positions, and those sorts of things, that's going to depend on a lot of different factors, including employer size, geographical location, educational attainment, years of experience, and necessary certifications. Okay. But generally, the BLS.org, the Bureau of Labor Statistics, generally for dental assistants and dental hygienists, from a national perspective, it's generally a positive outlook when it comes to um, position growth, right? Availability of positions across the country. Okay. So, while, where you are is, or employer size and those sorts of things kind of can affect, the outlook of, potential for growth or opportunities and things of that nature. Generally, across the country, BLS, Bureau of Labor Statistics, does show a positive upward trajectory in terms of availability of positions. Okay. Alrighty, so those are some of the differences between dental assistants and dental hygienists. Let's talk about some of the skills that you definitely strengthen as a dental assistant, and that could be applied to a dental hygienist role. Okay, so firstly, communication, right? Definitely the biggest one, I think, because both dental assistants and dental hygienists have to communicate with patients on a daily basis or a regular basis. They have to communicate with their team members, with dentists, and a lot of different people. Okay. So communication skills are they're indispensable, right? You have to have strong communication skills in order to do the work and do the work well, right? Also, collaboration. Again, dental assistants and dental hygienists have to collaborate with their team members. They have to collaborate with other dental assistants, dental hygienists, and dentists as well in order to provide that exceptional patient care. So you have to work closely in order to do things like solve problems, treat patients thoroughly, and complete each task quickly, efficiently, and thoroughly. Okay. Organization as well. It's really everybody's responsibility to make sure that the office is organized. Okay. And making sure that everything has a place, that everything is in its place so that you can, move through the day without a lot of obstacles and wasting a lot of time trying to find what it is that you need to find in order to treat that patient and help that patient. Okay. Computer literacy. That's another really great skill that you can obtain as a dental assistant and utilize as a dental hygienist. Both professionals have to have a working knowledge of computers, a variety of applications, including things like, um, applications to plan patient appointments, examine and update dental records, and confirm patients' insurance coverage as well. A lot of that is done virtually, right, online. So, or on rather not necessarily virtually, but on the computer, right? So definitely have to have that computer literacy. Customer service, right? That's definitely another big one. Kind of an obvious one, right? Because you're working with patients, you're working with a wide variety of patients, and you have to be able to help them. Um, with and we've mentioned in previous streams how a lot of patients can experience anxiety when coming to the dentist. So having those customer service skills is really, really important to help ease their ease their anxieties and to work with them in terms of things like scheduling examinations and treatment plans. Okay, attention to detail. Now, um, both roles have to have really strong attention to detail. It's definitely applied in different ways. For example, dental assistants have to pay close dental attention or close attention to detail when assisting the dentist or the dental hygienist, and when completing administrative tasks and things of that nature. Dental hygienists have to pay close attention to detail when documenting changes in dental and gum health, cleaning patients' teeth, examining x-rays and teeth to identify anomalies and treatment required areas. So different applications, but the need for attention to detail is definitely there, right? So that's definitely a skill that dental hygienists or dental assistants hone and that can be used in the role of dental hygienist. Time management, right? Sometimes you're working with patients back to back to back, and you have to have those time management skills, not just as a dental assistant, but also as a dental hygienist, to ensure that you don't get backed up and to ensure that each patient receives customized and tailored care. Okay. And lastly, empathy. Again, patients can experience anxiety, maybe even pain in terms of certain procedures and things of that nature. So having those empathy skills allows both dental assistants and dental hygienists to determine whether their patient is comfortable through the procedures that are being performed. Okay. Alrighty, so those are, definitely some of the skills that you can acquire as a dental assistant and use as a dental hygienist. Now let's talk about how to transition from being a dental assistant to a dental hygienist. These are the steps that you can follow in order to achieve that. Number one, acquire admission to a program for dental hygiene. Okay, admission can to these programs can be competitive. Okay, depending on the type of school or the type of program, it can be very, very competitive. So you definitely want to make sure that you are completing your resume or your CV with your experience as a dental assistant, and again focusing on those skills that we just talked about: communication, empathy, customer service, attention to detail, and all of those different skills to demonstrate that you already have a head start on becoming a dental hygienist. Okay. You're also going to want to talk about your familiarity with things like professional setting, right? You've been working in a dental office, right? Terminology, equipment, patient interactions, and processes. You have experience with all of that as a dental assistant. So make sure that you're focusing on those things in your resume or your CV. You'll want to take any necessary classes in biology, chemistry, general education, and writing, humanities, social science, and all those things to make sure that you have those prerequisites. And because most programs are considered, dental hygiene programs are considered or intended to be for full-time study, you're definitely going to want to talk with your present employer, if you're currently employed, about how to balance work and class schedules. So, okay, so that you can professionally develop and achieve your goals. Step number two, refine your skills during practical lessons. So, um, dental cleaning equipment, performing cleaning techniques on dental mannequins and classmates are all things that you have to finish in your practical lessons. Um, so you want to make sure that you are using straightforward communication, paying close attention to any indicators of pain or discomfort, keeping an eye out for nonverbal cues like stiffness or flinching, and checking with your test patient afterward to discuss any strategies that you might tweak in order to continue to improve your skills. Okay. Also, make sure that you're providing honest feedback to your classmates to help you learn what does and doesn't work during a procedure. Okay. Number three, pass clinical exams and training. So you may be able to complete your clinicals at the end of dental practice where you work, or the school might assign you an office. Okay. So you may have the option to complete those clinicals, at the place that you're currently working, if you're currently working. So you definitely want to ask for that clarification and assistance. Okay. Use the communication, observation, and customer service skills that you did throughout classroom training and, of course, honed in your current position to complete your clinical exams. Um, and generally, like I said, you usually complete your clinical exams at or near the end of the program. Okay. And your clinical exams are going to assess your ability to identify dental and oral anomalies, take accurate measurements, assess radiography, and diagnose dental disease and conditions. Okay. Step number 4, obtaining a license. And this, again, this is a must for dental hygienists. So you have to pass your state's dental hygiene licensure exam and the NBDHE in order to earn your license. The NBDHE is going to assess your ability to recall and apply dental hygiene science knowledge, patient care techniques, radiography testing, and review practices. And the state's licensing exam is going to test your understanding of best practices, patient care, provider responsibilities, and ethics. Okay. I have a comment here. That's a great salary for 1 year of school. Yeah, absolutely, Heidi. And both of them are really, really great salaries. Um, uh, and of course, I mean, obviously, dental hygienist earns more than dental assistant, so that's definitely something you can take into consideration if you decide that you want to continue on in your professional development and become a dental hygienist. Okay. All right, so step number 5, requesting an internship with your current employer. So you may be able to complete an internship with your current employer, which may result in a promotion to a dental hygiene role, like a dental hygienist role, right? So make sure that you're connecting with your employer, letting them know what is going on, that you are professionally developing, and that you can definitely continue to help the practice as a dental hygienist, right? And see what options are available in terms of promotion and progress. Okay. And finally, step number 6, apply for jobs as a dental hygienist. So, if your workplace isn't currently in need of a dental hygienist, then it's time to start looking for a dental hygienist role. Spend all of this time and effort and energy, professionally developing yourself and becoming a dental hygienist. So you definitely want to be able to use those skills, right? So if you are in the unfortunate circumstance where your current job just cannot accommodate a promotion or an internship, then it's time to start looking elsewhere, right? Um, so yeah, and again, make sure that when you create your resume, your cover letter, and any other application documents, that you are focusing on the fact that you've been a dental hygiene or a dental assistant, and that you have key skills that will definitely lend well, key skills and education that will definitely lend well to you becoming a dental hygienist. Okay, and of course, Princess Dental Staffing is here to help you find your dream job as a dental hygienist. So definitely think of Princess Dental Staffing when you go to look for a position as a dental hygienist. Okay, super easy, princessdentalstaffing.com to look for positions available in your area, and also create a profile and get your information in front of hiring managers. Okay. Alrighty, so those are our insights and tips and steps on how to transition from being a dental assistant to a dental hygienist. We hope that you found this information helpful and inspiring, and we will be back next week with another covering another topic regarding your career in the dental industry. Until then, though, everyone, have a great week, have a great weekend, continue to stay safe out there, and I will see you soon.